Welcome back to another explainer right here on the Rehab Haven Rehabilitation Center YouTube channel. Today we're doing a deep dive into the medical science, and honestly we're going to dismantle pretty much everything you thought you knew about body fat. Because it turns out it directly drives one of the most devastating things that can happen to a person, a stroke in young adulthood. We so often just think of weight as, a number on a scale, but the biological reality, it's way more dangerous and frankly, a whole lot more fascinating than that.
Dr. Philip Schauer over at the Cleveland Clinic really hits the nail on the head with this. He says, obesity is not merely a cosmetic problem. It is a metabolic fire burning continuously in the vascular system. We really have to stop viewing this as just a cosmetic issue or some sort of aesthetic failure. It is literally a metabolic fire, and it's burning continuously right inside your blood vessels. This is a severe active disease. And today we're going to learn exactly how that fire starts, how it attacks the brain, and most importantly, how we can put it out.
Okay, let's dive into this. Here's our roadmap for today's explainer. First, we'll cover the metabolic fire. Then, the anatomy of stroke risk, followed by the metabolic syndrome multiplier. After that, we'll look at cultural beliefs versus stroke danger. And finally, actionable prevention strategies.
Section 1. The metabolic fire. To really understand young adult stroke, we first have to completely correct a fundamental misunderstanding about what fat actually does inside the human body.
So for decades, the old myth was that body fat was basically just a storage locker, right? Just inert, passive weight sitting there doing nothing. But the medical reality is actually far more sinister. Visceral fat is an active, inflammatory endocrine organ. Think of it kind of like an evil villain's secret lair hidden deep inside your abdomen. It doesn't just sit there. It's constantly secreting dangerous molecules directly into your bloodstream, actively working against your vascular health.
And we definitely need to be specific about which fat we're talking about here. We're talking about visceral adipose tissue. This is the belly fat packed deep inside, wrapping around your internal abdominal organs, like your liver and your intestines. This specific metabolically active fat is the true driver behind a massive 50 to 100% increased risk of an ischemic stroke. It is the literal fuel for that metabolic fire. Which brings us to Section 2, Anatomy of Stroke Risk. So how exactly does this factory of visceral fat go about attacking your blood vessels and ultimately your brain? Well, this brilliantly illustrates it. Visceral fat actually deploys a whole arsenal of chemical weapons against your cerebrovascular system. It pumps out leptin, which raises your blood pressure and promotes clotting. At the same time, it reduces adiponectin, which leads to insulin resistance. Then you have cytokines like TNF-α and IL-6 that promote vascular inflammation. It even uses angiotensinogen, acting like a potent chemical boa constrictor to squeeze your vessels tighter, all while PAI-1 impairs your body's ability to break down dangerous clots. It's a highly coordinated attack. Let's move to Section 3, the Metabolic Syndrome multiplier. We need to see how this builds, because abdominal obesity really doesn't operate in a vacuum. It actively seeks out partners in crime.
When abdominal obesity teams up with other risk factors, your stroke risk doesn't just add up, it multiplies. It's terrifying. 1 + 1 doesn't equal 2 here, it equals 5. If we look at the diagnostic thresholds, abdominal obesity for women is a waist over 80 centimeters. Elevated fasting glucose is 5.6 millimoles per liter or higher, and hypertension is 130/80 or higher. And we see this multiplier actively at work in urban sub-Saharan Africa right now. In urban Ghana, roughly 40% of women aged 15 to 49 meet that threshold for abdominal obesity, while elevated fasting glucose is at 20 to 25%. And hypertension sits at a staggering 30 to 35% among all adults.
Section 4, Cultural Beliefs versus Stroke Danger. Now we have to step outside the biology for a second and look at the sociology, because how we culturally view body size can literally be a matter of life and death. I want you to really consider this question. What happens when cultural prosperity is actually a health risk? In a lot of societies, particularly in the Ghanaian context we just looked at, a larger body size has traditionally been a sign of prosperity, of wealth, health, and attractiveness. But what happens when that cultural badge of honor is simultaneously a ticking biological time bomb for a stroke? It creates this massive, devastating blind spot. Because if a young person doesn't even perceive their weight as a risk, why would they ever seek a medical assessment?
Now, what's really interesting about this is the sheer scale of the blind spot, 40%. Like we touched on, roughly 40% of urban Ghanaian women in that young 15 to 49 age bracket are carrying this substantial, growing stroke risk, and it's often going completely ignored without targeted prevention, simply because their culture is telling them they look healthy and prosperous.
To fix this, our whole clinical approach has to change. We absolutely must overcome weight stigma because judgment just delays care. If a patient feels judged, they're not coming back.
period. We need to shift the conversation to metabolic targets like blood pressure numbers and waist circumference instead of just obsessing over the number on the scale. We have to make it about vascular health, not aesthetics.
Section 5. Actionable Prevention Strategies. This is where we pivot entirely to empowerment and action, because taking control of this risk is incredibly achievable.
So the crucial point is this: you absolutely do not need to lose half your body weight to put out that metabolic fire. Just look at the impact. A modest 5 to 10% reduction in your body weight produces clinically massive drops in blood pressure, fasting glucose, and inflammation. That small percentage is enough to completely change your biological trajectory.
We extinguish the fire through holistic management strategies. It's about choosing fiber-rich whole foods over ultra-processed snacks. It's getting regular, low-impact aerobic and resistance exercise. But just as importantly, it's about sleep optimization to regulate your appetite hormones and stress reduction. Chronic stress floods your body with cortisol, which literally directs your body to store more of that dangerous visceral fat. So fixing your rest and stress levels is just as vital biologically as fixing your diet.
Now, I want to give you your ultimate tool for stroke prevention. It's not some expensive, complex medical device. It is a simple tape measure. BMI is fine, sure, but measuring your waist circumference is the true, non-negotiable clinical step. Here's exactly how you do it. First, stand up straight. Second, identify the midpoint between your lowest rib and the top of your hip bone, the iliac crest. And third, apply the tape measure right at the end of a natural breath out, your end tidal exhalation. That's it.
And here are the high-risk alert targets you need to know. For men, a waist circumference over 102 centimeters puts you in the high-risk zone. For women, it's anything over 88 centimeters. If you're hitting these targets, that metabolic fire is actively threatening your brain right now. But the amazing thing is, reducing that measurement by just 5 to 10 centimeters over the next 6 months drastically lowers your danger level.
So, I'm going to leave you with this final vital question. Do you know your waist circumference? If you don't, your homework is to grab a tape measure today, find out your number, set a target to reduce it safely over the next 6 months, and take back control of your metabolic health. Thank you so much for joining us for this explainer on the Rehab Haven Rehabilitation Center channel. Take action today and stay healthy.